We had a conversation with family physician Dr. Adrian Lorde on what precautions BARP members should take if they are being affected by volcanic dust. And this is what he said.
Well, BARP members are over the age of 50. Their lungs are not as good as they were when they were 15. They may have chronic respiratory conditions. They may have had asthma. They've been smokers. They have had all sorts of things insulting their lungs and their various bodies. The volcanic ash fall contains sulfur and sulfuric acid and sulfur dioxide, silica gas. As a matter of fact, there's a condition that they can have, especially if they have a history of asthma or chronic respiratory problems, that could affect their lungs and seriously from the ashfall. So they should protect themselves. Yes, a lot of cleaning has been going on. But stay inside. We've been saying that all along from the time of the COVID-19 pandemic, but stay inside, protect yourself with masks. That sounds familiar as well. Double mask even, because some of the particles are fine or extra fine, and these could affect your lungs, your eyes, scratching your cornea, your nose, causing rhinitis and what we call sinus problems, your throat, and even your skin, and maybe even your mental health. So you need to protect your body by wearing masks. If you're out there, wear long sleeve clothes and long pants and boots and goggles if you have to be there. And don't be out there lifting heavy things, because then that back might, as we will say, Beijing, give out.
So are there any long-term effects that you might get from inhaling too much volcanic ash?
Yes, Peter. There's something called pneumo-ultra-microscopic silica volcanosis. That's all one word. And that is really the silicosis or the fibrosis or the hardening of the lungs and scarring of the lungs as a result of exposure, chronic long-term effects from exposure to that volcanic ash. And this is serious because it can lead you to respiratory problems, shortness of breath, and even premature death, because it puts pressure on the whole body and the heart and so on. So we need to be very careful. And while on that point of what effect it could have on the lungs in particular, I want to mention before I forget that we, in members of BARP, have to be very careful, because there are a lot of people out there who are parading as cleaners, and our members may be encouraged to pay them for a job that they may not do or may not do properly. Oh, I could clean for you. I could clean down the drains. I could sweep up the yard. I could get rid of this thing. And some of them are not doing what they're doing. They come and use up all your water and take your money and go. So be careful. Ask for advice from someone, a family member, if this is a reasonable cost for a job that may be done to help yourself out.
So you're saying that you should be careful that you get a professional cleaner, because there's a danger, like take for example, where people say that they have to clean the air conditioning systems. So those kinds of people should be professionals.
Yes, the air conditioning systems. And we ask to close our windows, stay inside, and try not to use the air conditioning system, because then the filters could be affected. But even cleaning other parts of the house and the yard and the driveway and all sorts of things, and the cars, be careful with people who may take advantage of you.
BARP, all accidents, for ground.